One day last week, not wanting to tell my colleagues a lie, I explained to them I would be taking the next day off, sick. I did have a cold, I did have a headache. Physically, I was fine. What wasn't fine was my mental health. I felt like I was drowning in work, in bills, in life in general. I had reached a point where something had to give, and that something was me. I had to give myself a break. I had to give myself permission to take a day off to look after myself. Share on Facebook, share on Twitter, tweet link. Almost 900,000 Western Australia residents used at least one day of their sick leave for mental health or stress issues in the past 12 months. Photo, Louis Duvas. Following a full 24 hours with no deadlines, no emails and no phone calls, I felt human again. It was amazing what such a small time to myself did for my mental health. This is how journalist Kate Headley described her experience taking a mental health day from her job as a regional editor in a piece for Fairfax Media last year. Share on Facebook, share on Twitter, tweet link. Stress leave is offered by Western Australia employers. Kate is not alone. Exclusive new data obtained by WA Today has revealed West Australian workers are the most likely to take time off work for their mental health in the nation. Advertisement Titan request ad push, ad spot -300 extension 250, pose 3. The new study, conducted by Finder.com.au, shows 890,000 Western Australia residents used at least one day of their sick leave for mental health or stress issues in the past 12 months. This is almost 34% of the state's workforce. The study also found 26% of full-time workers have taken time off for stress compared to only 8% of part-time employees, and 4 times as many Generation Y workers have used their sick leave for a mental health day than working baby boomers. Life Western Australia Chief Executive Officer Lorna McGregor said while the amount of West Australians apparently suffering from work-related stress or mental health issues was troubling, it would continue to encourage employees to look after their mental well-being. It is not a surprise, 1 in 5 Australians experience a mental illness in every year, so it is only to be expected that a large number of people would need to take time off for treatment or rest. She said. Ms. McGregor said she could only speculate why baby boomers seem to be less inclined to take time off for mental health issues. Anecdotally, I can tell you that younger people are more likely to disclose that their day off is due to mental ill health. She said baby boomers probably don't feel comfortable to be honest about their reason for the day off. If a staff member needs to take a day off for treatment or rest for a mental illness, they should not be treated any differently to someone who has a physical illness. I believe that employers in Western Australia are becoming increasingly aware of the need to create mentally healthy workplaces. More and more organisations contact Lifeline Western Australia to organise for our education team to provide mental health training, but employers can also help by making staff feel comfortable to take time when they need it. Work Cover Western Australia conducted a study last year in order to determine the prevalence of stress leave in 2016 and found the top 3 industries affected by stress-related claims were healthcare and social assistance, public administration and safety, and education and training. It found work pressure was the #1 cause of stress claims in Western Australia, followed by harassment and bullying and exposure to a traumatic event. The average stress claim cost was found to be around $73,895, with an average of 148 days lost per claim.